So heartworm disease can be incredibly complicated and a bit difficult to understand. Let's see if we can clear some things up for you. Hello all, Dr. Rhett here, and today the conversation is going to be all about heartworm disease. Today's video is going to concentrate on several questions that I tend to get asked a lot, as well as some myths and misconceptions about the disease itself. But before we go too far, it's actually important that I give you at least a brief overview of the heartworm life cycle, because that's going to be important later on when we start talking about some of these topics. Now just bear with me, I'll keep it as short and concise as I can, but it's very important. So basically what happens is a mosquito comes along and it takes a blood meal from a dog that already has heartworms. As the mosquito is taking a meal, it'll actually suck up baby heartworms that are in the bloodstream. After a period of time in the mosquito, the heartworm grows up and develops into what we call an L3, or the infective phase, and then migrates to the mouth parts of the mosquito. When that mosquito lands on another dog and takes a blood meal, that infective phase of the heartworm then is transferred into the tissues of the dog. From there, the heartworm takes a long journey that takes approximately 6 to 7 months as it grows up into an adult and will eventually wind up near the heart. Now, the term heartworm is actually a little bit of a misnomer because heartworms don't actually live inside the heart. They actually set up camp in the main pulmonary artery, which is the major artery that leaves the heart and brings the blood to the lungs. Once the adults are there and all set up, then they find another adult, have a few drinks, make some bad decisions, and the next thing you know, baby heartworms start happening. Once those baby heartworms are born, they enter into the blood circulation, and there you have it. That's the whole life cycle. Another mosquito comes by and takes a blood meal and then picks up those babies, and the cycle starts all over again. So hopefully by now you're still with me, and we'll get into the questions. One of the most common questions that I get asked from my clients is, they say, I have this little teeny tiny teacup barely dog thing that never touches the ground and doesn't go outside to use the bathroom. Or my little dog only goes outside to do its business and then comes right back in, so I shouldn't need heartworm prevention, right? That's actually wrong. As a matter of fact, as of the filming of this video, my very last heartworm patient was a little teeny tiny barely dog teacup thing that never went outside. And that's because mosquitoes still get inside your house and they can still infect the dog. Sometimes my owners come to me and they say, hey, I missed some heartworm prevention, so what do I do now? And the advice that I usually give them is, let's get them started back on heartworm prevention. And about 6 to 7 months after the missed dose, we're going to test for heartworms. The reason why I don't test for heartworms right away if they just missed a dose is, if you remember, it takes about 6 to 7 months from the time the dog is infected to the time that the heartworm grows up into an adult that's having babies. The reason why I don't test right away is because the heartworm tests that we use can only detect whenever there is a pregnant adult. It's looking for something called an antigen, or a chemical signal that these adults put out into the blood. So there's a chance that if you test too soon, even if they have heartworms, they're not gonna cause a positive test. So now the big subject. Your dog has tested heartworm positive for one reason or another. What now? So basically, we'll start with a very good physical exam. If your dog is showing some clinical signs, those clinical signs might include something like a heart murmur or maybe a persistent cough. Heartworm disease doesn't just affect the heart. Heartworm disease actually causes massive inflammation to the lungs and to the vessels of the lungs, and it can cause vasculitis in other parts of the body. It can pretty much wreak havoc. So it's not just going to present itself as something like a heart murmur or heart failure. It can a lot of times look like a persistent cough. Sometimes the inflammation in the lungs gets so bad that that cough can actually turn into coughing up blood, or in really bad infections, I have actually seen patients cough up actual heartworms. Depending on the patient's condition, then we'll have a conversation, and that conversation is going to include, how are we going to treat this heartworm disease? Now, I'll tell you that I'm not going to go right into the way that I treat heartworm disease, because if you talk to 5 different doctors, depending on where they live and how prevalent the disease is in their area, they may approach it slightly differently. But In general, most people will follow guidelines from the American Heartworm Association. So if you're actually interested in how we treat heartworm disease, I'll leave a link below to the American Heartworm Association's website so you can go through and see exactly what they recommend treatment-wise. There is one condition that heartworm disease can cause. There's no way to predict if the patient is going to wind up with this condition. However, this condition is something called cable syndrome. This syndrome has a whole constellation of clinical signs and symptoms. So without getting too far into the nitty-gritty details of what cable syndrome is, basically cable syndrome happens whenever the heartworms, which if you remember live in the main pulmonary artery just outside of the heart, for some reason knock loose and fall down into the heart. Now this causes a bunch of different disruptions, mainly to blood flow and to the ability of the heart to beat appropriately and bring blood where it's supposed to go. This does things like shredding up the red blood cells. And the consequence of that you'll see at home is suddenly your dog will start to urinate what looks like something like port wine. I mean, the urine is going to be incredibly dark red. So if you have a dog with heartworm disease and you see this, it's very important that you go ahead and bring your dog in to your veterinarian so that it can be evaluated for possible cable syndrome. This can be a life-threatening situation, and sometimes the only treatment is an emergency surgery. During that surgery, we actually go into the jugular vein in the neck with either some very long forceps or some other tools that are specially made for this type of surgery. You go down into the heart through the jugular vein and you start pulling out as many worms as you possibly can. Ideally, you'll get all the worms that have fallen into the heart. And if you get all of the heartworms out or enough of them out to stop the syndrome, they recover very quickly. But this is a bit of a risky surgery. So we only perform it when we know cable syndrome is occurring and whenever we know that if we don't perform the surgery, they're gonna die anyway. So a lot of times when people learn about this surgery, I get asked the question, hey, can we just go in and take the heartworms out before they develop cable syndrome? In order to get the heartworms that are in the main pulmonary artery, you would have to be able to make some kind of a tool that would go in through the jugular vein, make a huge turn, and then go up out of the heart into the main pulmonary artery, and that just doesn't exist. So no, you can't surgically remove the heartworms unless they have fallen into the heart and are causing cable syndrome. Another huge question that I get asked is, well, since my dog's being treated for heartworms, I don't have to give heartworm prevention, right? And that's actually incorrect. When you treat for heartworms, the medications that you give in order to kill the adult heartworms don't actually kill the babies. And so it's very important that you keep your pet on heartworm prevention while it's being treated for heartworm disease, or else they could get more babies while you're treating the adults, and then you wind up with heartworm disease again, even though you've gone through the treatment. But Dr. Rhett, you say, if heartworm disease is spread by mosquitoes, can't other things that get by mosquitoes get heartworms? And the answer is yes. Things like dogs, wolves, werewolves? Werewolves? Can werewolves get heartworm disease? More importantly, if a werewolf gets heartworm disease, does it go to a human physician or to a veterinarian? And actually, a more serious question that people ask is, people get bit by mosquitoes. Can people get heartworm disease? The short answer of it is no. A lot of these parasites are species specific. So if a mosquito bites a person and that mosquito is infected with heartworms, yeah, they could pass the heartworm over to the person, but because the person is not the target species for that heartworm, basically what happens is that heartworm dies and the person's immune system takes over and cleans out the trash. Now, I guess in some situations, if a person is severely immunocompromised, either by illness or by being on medications that blunt the immune system, I guess maybe they could potentially have what we call some kind of an aberrant infection, but that's pretty rare. One last main topic, and that's that, believe it or not, cats actually can get heartworms as well. The difference is that heartworm disease affects cats differently. Dogs can have a huge amount of heartworms in that main pulmonary artery, but a cat can get incredibly sick off of a single heartworm. Heartworms cause a massive inflammatory response in cats. And that usually looks like some kind of respiratory distress. It can look like asthma, coughing, wheezing, and it can lead to a life-threatening respiratory disease in cats. So it actually is important that cats be kept on heartworm prevention as well. Although cats don't tend to get heartworm disease as often as dogs, it is possible. One of the main points that I would like to make in this particular video is that prevention is way better than treatment of the disease. So if you keep them on prevention religiously, their chances for getting the disease goes way down. And at the end of the day, they're going to be healthier and happier. And because treatment can be very expensive, it'll be much more affordable for you in the long run. So guys, this was my first video in this series. I hope you found it informative. I hope you enjoyed it. I hope you learned a little something. Please feel free to leave any questions down in the comments below as far as other subjects that you would love to ask. I'm also going to leave a link below to the American Heartworm Association's website. I only brushed the surface of the true complexity of heartworm disease. So if you're at all interested, please feel free to go down and check that link out. Until next time, thanks for watching. Please hit that like and subscribe button, turn on notifications, leave a comment, share, and hopefully I'll be back soon with another one of these videos. Take care.